Question 1. Market research demonstrates that many individuals seeking weight management support struggle with long-term adherence to dietary and lifestyle changes. A new patient, a 45-year-old female with a BMI of 32, presents for nutrition counseling. She expresses a desire for rapid weight loss and has previously tried several restrictive diets with limited success. She is motivated but also expresses concerns about the sustainability of any new plan. As the RDN, which of the following approaches best addresses her needs and aligns with current U.S. regulatory and ethical guidelines for weight management? Option A. Focus solely on calorie restriction by recommending a daily intake of 1,200 calories, emphasizing strict adherence, and discouraging any discussion of other weight management modalities until she achieves her initial weight loss goal. Option B. Recommend a comprehensive bariatric surgery consultation immediately, given her BMI, to address her weight concerns definitively and quickly, with minimal emphasis on pre- or post-operative lifestyle modifications. Option C. Prescribe a very low-calorie ketogenic diet, VLCKD, for immediate and significant weight loss, as this has shown rapid results in clinical trials, and provide a brief handout on general healthy eating principles for long-term maintenance. Option D. Develop a personalized, evidence-based weight management plan that integrates gradual, sustainable changes in energy intake and expenditure, incorporates behavioral modification techniques to address adherence challenges, and includes ongoing monitoring and support, while discussing the potential roles of pharmacotherapy or bariatric surgery as adjuncts if appropriate and after thorough assessment. The correct answer is D. Develop a personalized, evidence-based weight management plan that integrates gradual, sustainable changes in energy intake and expenditure, incorporates behavioral modification techniques to address adherence challenges, and includes ongoing monitoring and support, while discussing the potential roles of pharmacotherapy or bariatric surgery as adjuncts if appropriate and after thorough assessment. Explanation. This scenario presents a common implementation challenge for registered dietitian nutritionists, RDN, in the United States, specifically concerning weight management. The challenge lies in balancing evidence-based practice with patient autonomy and the practicalities of long-term adherence to complex lifestyle changes. The RDN must navigate the ethical imperative to provide effective, safe, and individualized care while respecting the patient's right to make informed decisions about their health. This requires a deep understanding of various weight management strategies, their potential benefits and risks, and the psychological and social factors influencing patient behavior. The correct approach emphasizes a collaborative and individualized strategy that integrates multiple evidence-based components of weight management. This aligns with the Academy of Nutrition and Dietetics standards of practice and professional performance, which mandate patient-centered care, cultural competence, and the use of a systematic process for nutrition care. Specifically, it reflects the principles of motivational interviewing and the transtheoretical model of change, encouraging patient engagement and readiness for change. The focus on sustainable lifestyle modifications, including behavioral strategies and a balanced approach to energy intake and expenditure, is crucial for long-term success and aligns with guidelines from organizations like the National Institutes of Health, (NI), and the Centers for Disease Control and Prevention, CDC, for obesity management. This approach prioritizes patient education, skill building, and ongoing support, empowering the patient to achieve and maintain their weight goals safely and effectively. An incorrect approach that solely focuses on a rapid, restrictive diet without addressing behavioral components or considering the patient's readiness for change is ethically problematic. Such an approach may violate the principle of beneficence by potentially leading to nutrient deficiencies, disordered eating patterns, or unsustainable weight loss, which can be detrimental to the patient's health. It also fails to uphold the principle of autonomy by not adequately involving the patient in the decision-making process or respecting their individual needs and preferences. Furthermore, recommending pharmacological or surgical interventions without a thorough assessment of their appropriateness, potential risks, and the patient's understanding and commitment to post-intervention lifestyle changes would be a significant regulatory and ethical failure. This could lead to adverse events, suboptimal outcomes, and a breach of professional responsibility to provide safe and effective care as outlined by the Commission on Dietetic Registration, CDR. Code of Ethics for the Profession of Dietetics. A professional decision-making process for similar situations should involve a comprehensive assessment of the patient's health status, medical history, psychosocial factors, readiness for change, and personal preferences. The RDN should then collaboratively develop an individualized nutrition care plan that incorporates evidence-based strategies, prioritizing sustainable lifestyle modifications. This plan should include education on energy balance, macronutrient distribution, and behavioral techniques for self-monitoring and adherence. Regular follow-up and ongoing support are essential to monitor progress, address challenges, and make necessary adjustments to the plan. The RDN must also be prepared to discuss the role of pharmacotherapy and bariatric surgery as adjuncts to lifestyle interventions, ensuring the patient is fully informed of the risks, benefits, and requirements of these options. Question 2. Strategic planning requires an RDN to accurately estimate a patient's total daily energy expenditure. Considering the U.S. regulatory framework for RDNs, which of the following approaches best reflects ethical and evidence-based practice when assessing a patient with complex metabolic needs? Option A. Recommending a broad range of caloric intake based on general population guidelines for similar age and gender, without specific measurement or detailed individual assessment of energy expenditure components. Option B. Relying solely on generalized equations like the Harris-Benedict equation to estimate basal metabolic rate, and then adding a standard percentage for physical activity without further individual assessment. Option C. Interpreting the results of indirect calorimetry and then independently adjusting medication dosages to optimize metabolic rate, as this is a direct factor influencing energy expenditure. Option D. Utilizing indirect calorimetry to precisely measure resting energy expenditure, then applying established multipliers for the thermic effect of food and physical activity based on the patient's reported lifestyle. The correct answer is D. Utilizing indirect calorimetry to precisely measure resting energy expenditure, then applying established multipliers for the thermic effect of food and physical activity based on the patient's reported lifestyle. Explanation: this scenario is professionally challenging because it requires the registered dietitian nutritionist, RDN, to apply complex physiological concepts of energy expenditure within the strict confines of U.S. regulatory frameworks governing dietetic practice. The RDN must not only understand BMR, TEF, physical activity, and their influencing factors, but also how to ethically and legally incorporate these into patient care plans, particularly when considering indirect calorimetry. The challenge lies in translating scientific knowledge into actionable, evidence-based, and compliant interventions. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to the ethical principles and scope of practice for RDNs as defined by the Commission on Dietetic Registration, CDR, and relevant state licensure laws. This approach involves a comprehensive assessment that considers individual patient factors, utilizes appropriate assessment tools like indirect calorimetry when indicated and within the RDN scope, and develops a personalized energy expenditure plan that is safe, effective, and evidence-based. This aligns with the RDN's responsibility to provide competent and ethical nutrition care. An incorrect approach that relies solely on generalized population data without considering individual variability or the limitations of indirect calorimetry would be a regulatory failure. This is because it deviates from the principle of individualized nutrition care, which is a cornerstone of RDN practice and is implicitly or explicitly required by professional standards and state practice acts. Such an approach could lead to inaccurate energy recommendations, potentially harming the patient, and would not meet the standard of care expected of a credentialed professional. Another incorrect approach might involve overstepping the RDN scope of practice by interpreting complex physiological data in a manner reserved for physicians or other medical specialists, which would be a violation of professional boundaries and potentially state licensure laws. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, the available evidence, the RDN scope of practice, and relevant regulatory guidelines. This includes critically assessing the appropriateness of diagnostic tools, understanding the limitations of each component of energy expenditure, and collaborating with other healthcare professionals when necessary to ensure comprehensive and ethical patient care. Question 3. Implementation of a nutrition care plan for a patient with type 2 diabetes experiencing significant bloating and abdominal discomfort after consuming typical carbohydrate sources requires the registered dietitian nutritionist, RDN, to consider how to best manage both glycemic control and digestive tolerance. Which of the following approaches best reflects a comprehensive and evidence-based strategy for this patient within the U.S. regulatory framework? Option A. Prioritize a detailed assessment of the patient's current carbohydrate intake, symptom patterns, and potential triggers for gastrointestinal distress. Then develop a personalized plan that incorporates well-tolerated carbohydrate sources and appropriate fiber management strategies to support both blood glucose regulation and digestive comfort. Option B. Recommend eliminating all sources of dietary fiber, as fiber is often implicated in gastrointestinal distress, and then address the patient's diabetes management separately. Option C. Immediately implement a strict low-carbohydrate diet to minimize carbohydrate load and reduce potential fermentation in the gut, without further investigation into specific carbohydrate types or the patient's overall nutritional status. Option D. Focus solely on carbohydrate counting, using standard exchange lists to ensure adequate insulin response for diabetes management, advising the patient to manage their gastrointestinal symptoms independently. The correct answer is A. Prioritize a detailed assessment of the patient's current carbohydrate intake, symptom patterns, and potential triggers for gastrointestinal distress. Then develop a personalized plan that incorporates well-tolerated carbohydrate sources and appropriate fiber management strategies to support both blood glucose regulation and digestive comfort. Explanation. Scenario analysis. This scenario presents a common challenge for registered dietitian nutritionists, RDN, in the United States, specifically navigating the complexities of carbohydrate metabolism for a patient with type 2 diabetes who is also experiencing gastrointestinal distress. The challenge lies in balancing the need to manage blood glucose levels effectively through appropriate carbohydrate intake with the patient's digestive limitations, which may be exacerbated by certain types of carbohydrates, particularly those high in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols FODMAP. The RDN must consider not only the quantity of carbohydrates, but also their quality and impact on gut health, all while adhering to evidence-based practice and patient-centered care within the U.S. regulatory framework. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient's current dietary intake, symptomology, and medical history, including a detailed understanding of their type 2 diabetes management and gastrointestinal complaints. This allows for the development of a personalized nutrition intervention that addresses both conditions. The RDN would focus on selecting carbohydrate sources that are well tolerated digestively while still supporting glycemic control. This might involve recommending lower FODMAP carbohydrate options, emphasizing soluble fiber over insoluble fiber if fermentation is a primary issue, and educating the patient on portion control and the timing of carbohydrate intake to minimize blood glucose fluctuations and digestive discomfort. This approach aligns with the Academy of Nutrition and Dietetics standards of practice and professional performance for RDNs, which mandate evidence-based practice, patient-centered care, and the integration of scientific knowledge into practice. It also implicitly adheres to guidelines for diabetes management and gastrointestinal health, ensuring the patient receives safe and effective nutrition care. Incorrect approaches analysis. One incorrect approach would be to solely focus on carbohydrate counting for diabetes management without considering the patient's gastrointestinal symptoms. This fails to address the patient's holistic needs and could lead to increased digestive distress, potentially impacting adherence to the diabetes management plan. Ethically, this approach neglects the RDN's responsibility to consider all relevant patient factors impacting their health and well-being. Another incorrect approach would be to recommend a very low-carbohydrate diet without a thorough assessment of its suitability for the patient's specific type of diabetes and gastrointestinal issues. While low-carbohydrate diets can be effective for glycemic control, they may not be appropriate for all individuals, especially those with certain digestive sensitivities, and could lead to nutrient deficiencies if not carefully planned. This approach risks oversimplifying a complex nutritional problem and could be detrimental to the patient's health, violating the principle of providing safe and individualized nutrition care. A third incorrect approach would be to dismiss the patient's gastrointestinal complaints as unrelated to their diet and continue with a standard diabetes meal plan. This demonstrates a lack of thorough assessment and patient advocacy. The RDN has a professional obligation to investigate all reported symptoms and their potential dietary contributors, ensuring a comprehensive and integrated approach to patient care. Failure to do so could lead to suboptimal outcomes and a breakdown in the therapeutic relationship. Professional reasoning. When faced with a patient presenting with multiple, potentially interacting health conditions, the RDN must employ a systematic and comprehensive approach. This involves a thorough assessment of the patient's medical history, current symptoms, dietary intake, and lifestyle. The RDN should then integrate this information with current scientific evidence and professional guidelines to develop a personalized and evidence-based nutrition care plan. This plan should prioritize the patient's safety, efficacy of intervention, and adherence, while also considering their individual preferences and circumstances. Regular monitoring and evaluation of the patient's response to the intervention are crucial for making necessary adjustments and ensuring optimal outcomes. Question 4. Benchmark analysis indicates that a 72-year-old male patient admitted with dehydration and hyponatremia is experiencing muscle weakness and confusion. His current medications include a diuretic and an ACE inhibitor. The physician has ordered laboratory tests to assess his electrolyte levels. As the registered dietitian nutritionist, RDN, what is the most appropriate initial step in managing this patient's fluid and electrolyte balance? Option A. Provide the patient with a detailed list of low-sodium food choices to help manage his hyponatremia. Option B. Suggest to the physician that the patient's diuretic be discontinued to correct the hyponatremia. Option C. Recommend a specific oral rehydration solution with a carefully balanced electrolyte profile to the physician for consideration. After reviewing the patient's laboratory results, Option D. Advise the patient to immediately increase his intake of potassium-rich foods to address the potential for hypokalemia secondary to the diuretic. Correct answer is C. Recommend a specific oral rehydration solution with a carefully balanced electrolyte profile to the physician for consideration after reviewing the patient's laboratory results. Explanation. This scenario is professionally challenging because it requires the registered dietitian nutritionist, RDN, to navigate a complex patient situation involving multiple potential interventions for fluid and electrolyte imbalance, while adhering to the scope of practice and ethical guidelines. The RDN must consider the patient's underlying medical conditions, current medications, and individual needs to formulate a safe and effective plan. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and collaborative care. This aligns with the Academy of Nutrition and Dietetics Code of Ethics, which emphasizes providing evidence-based, individualized care and working within the RDN's scope of practice. Specifically, the RDN's responsibility includes assessing nutritional status, developing and implementing nutrition care plans, and monitoring patient progress. Collaborating with the physician ensures that the nutrition plan is integrated with the overall medical management, preventing potential conflicts or adverse interactions. This approach upholds the ethical principle of beneficence by acting in the patient's best interest and non-maleficence by avoiding harm. An incorrect approach that focuses solely on recommending a specific dietary supplement without a thorough assessment or physician consultation fails to meet professional standards. This could lead to inappropriate interventions, potential adverse effects, or masking of underlying issues. Ethically, this violates the principle of competence, as the RDN has not gathered sufficient information to make an informed recommendation. It also bypasses the physician's role in medical management, potentially creating a conflict and undermining the collaborative care model. Another incorrect approach that involves making definitive medical diagnoses or prescribing medications is outside the RDN's scope of practice. This is a clear violation of professional boundaries and regulatory frameworks governing the practice of dietetics. Such actions could result in legal repercussions and harm to the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's current status, including medical history, medications, laboratory values, and dietary intake. 2. Identify the specific nutrition-related problems, contributing to the fluid and electrolyte imbalance. 3. Consult with the physician and other healthcare team members to understand the medical context and coordinate care. 4. Develop an individualized nutrition intervention plan that is evidence-based and within the RDN scope of practice. 5. Monitor the patient's response to the intervention and adjust the plan as needed. 6. Document all assessments, interventions, and outcomes meticulously. Question 5. The audit findings indicate a potential concern regarding the fat-soluble vitamin status of several patients. Which of the following approaches best addresses this concern within the scope of registered dietitian nutritionist (RDN) practice? Option A. Focus solely on patients reporting symptoms suggestive of vitamin D deficiency, as it is the most commonly discussed fat-soluble vitamin. Option B. Recommend a broad-spectrum vitamin and mineral supplement to address any potential deficiencies without specific assessment. Option C. Advise patients to increase their intake of all fat-soluble vitamin supplements to ensure adequate levels. Option D. Conduct a detailed dietary assessment for each patient, focusing on food sources of vitamins A, D, E, and K, and correlate findings with clinical signs and symptoms of deficiency or toxicity. The correct answer is D. Conduct a detailed dietary assessment for each patient, focusing on food sources of vitamins A, D, E, and K, and correlate findings with clinical signs and symptoms of deficiency or toxicity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered dietitian nutritionist (RDN) to interpret audit findings related to patient care and identify potential deviations from established best practices and regulatory guidelines concerning fat-soluble vitamins. The challenge lies in accurately assessing the adequacy of dietary intake, understanding the complex roles of these vitamins, and recognizing the signs and symptoms of both deficiency and toxicity, all within the scope of RDN practice. The RDN must synthesize information from patient records, dietary assessments, and clinical observations to make informed recommendations. Correct approach analysis. The correct approach involves a comprehensive review of the patient's dietary intake of fat-soluble vitamins, considering their specific functions, common food sources, and the patient's individual health status and potential risk factors for deficiency or toxicity. This approach aligns with the RDN's ethical responsibility to provide evidence-based, patient-centered care and adhere to professional standards of practice. It necessitates understanding the nuances of vitamin A retinoids and carotenoids, vitamin D, vitamin E, and vitamin K, including their absorption, metabolism, and potential interactions. This thorough assessment allows for the identification of specific nutritional gaps or excesses and the development of targeted interventions to optimize the patient's health outcomes, thereby meeting regulatory expectations for competent nutrition care. Incorrect approach is analysis. One incorrect approach would be to focus solely on the patient's reported consumption of fortified foods without considering other dietary sources or the patient's absorption capacity. This fails to account for the full spectrum of vitamin intake and ignores potential underlying issues that could affect nutrient status, violating the principle of individualized nutrition care and potentially leading to misdiagnosis of deficiency or toxicity. Another incorrect approach would be to recommend high-dose supplementation of a fat-soluble vitamin based on a single laboratory value, without a thorough dietary assessment or consideration of the patient's clinical presentation. This disregards the potential for toxicity associated with fat-soluble vitamins, which are stored in the body, and overlooks the importance of obtaining nutrients from food sources whenever possible, contravening established guidelines for safe and effective supplementation. A further incorrect approach would be to dismiss the audit findings as irrelevant without a proper evaluation of the patient's fat-soluble vitamin status. This demonstrates a lack of professional diligence and a failure to uphold the RDN's responsibility to ensure optimal patient nutrition, potentially leading to adverse health consequences for the patient and a breach of professional standards. Professional reasoning. Professionals should approach such situations by first understanding the scope of the audit findings and their potential implications for patient care. This involves a systematic review of the patient's nutritional status, including dietary intake, clinical signs and symptoms, and relevant laboratory data. The RDN should then apply their knowledge of fat-soluble vitamin functions, sources, deficiency, and toxicity to interpret this information. Decision-making should be guided by evidence-based practice, ethical principles and regulatory requirements, prioritizing patient safety and well-being. When in doubt, consulting with colleagues or relevant literature is a crucial step in ensuring the most appropriate and effective care plan is developed. Question 6. The performance metrics show a client presenting with generalized fatigue, muscle weakness, and occasional bone pain. The client reports a diet that is high in processed foods and low in dairy and leafy green vegetables. The RDN is considering potential macromineral imbalances contributing to these symptoms. Which of the following approaches best reflects a comprehensive and evidence-based strategy for this client? Option A. Conduct a detailed dietary assessment to quantify intake of all macrominerals, calcium, phosphorus, magnesium, sodium, potassium, chloride, sulfur, and correlate this with the client's reported symptoms. Then consult current evidence-based guidelines to formulate an individualized nutrition care plan. Option B. Immediately recommend a high-dose calcium supplement to address potential bone pain and fatigue, as dairy is a primary source of calcium. Option C. Provide general advice on reducing sodium intake due to the high consumption of processed foods, without further investigation into other macromineral statuses. Option D. Focus solely on increasing potassium intake, as muscle weakness can be a symptom of hypokalemia, and advise the client to consume more bananas. The correct answer is A. Conduct a detailed dietary assessment to quantify intake of all macrominerals, calcium, phosphorus, magnesium, sodium, potassium, chloride, sulfur, and correlate this with the client's reported symptoms. Then consult current evidence-based guidelines to formulate an individualized nutrition care plan. Explanation. Scenario analysis. This scenario presents a common challenge for registered dietitian nutritionists, RDN, where a client exhibits symptoms that could be related to multiple macromineral imbalances. The challenge lies in differentiating between potential causes and formulating an appropriate intervention plan based on the client's reported dietary intake and symptoms, while adhering to professional scope of practice and evidence-based guidelines. The RDN must consider the complex interplay of these minerals and their impact on various bodily functions. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes gathering comprehensive information to accurately diagnose the potential macromineral imbalance. This includes a detailed dietary assessment to quantify intake of calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur, and correlating this with the client's reported symptoms. The RDN should then consult current evidence-based guidelines and position papers from reputable organizations, such as the Academy of Nutrition and Dietetics, to inform their assessment and recommendations. This approach ensures that interventions are tailored to the individual, evidence-based, and within the RDN's scope of practice, prioritizing client safety and well-being. Incorrect approaches analysis. One incorrect approach would be to immediately recommend a specific high-dose supplement without a thorough assessment. This fails to identify the root cause of the symptoms, potentially exacerbating an existing imbalance or creating a new one. For example, recommending a high-dose calcium supplement without assessing phosphorus intake could negatively impact calcium-phosphorus balance. This is a regulatory and ethical failure, as it constitutes practicing outside the scope of a comprehensive nutritional assessment and could lead to harm. Another incorrect approach would be to focus solely on one macromineral based on a single prominent symptom, ignoring other potential contributing factors. For instance, if a client reports muscle cramps, focusing only on magnesium and neglecting potassium or calcium could lead to an incomplete or ineffective intervention. This is a failure to apply a holistic and evidence-based approach, potentially delaying appropriate diagnosis and treatment. A third incorrect approach would be to provide general dietary advice without considering the client's specific intake patterns and symptomology. Simply stating "eat more dairy for calcium" without understanding the client's current consumption or potential absorption issues is insufficient. This approach lacks the individualized care expected of an RDN and may not address the underlying problem, representing a failure in professional responsibility. Professional reasoning. RDNs should employ a decision-making framework that begins with a thorough client assessment, including a detailed dietary history, symptom review, and relevant medical history. This is followed by data analysis, where the RDN interprets the gathered information in light of current scientific literature and professional guidelines. Based on this analysis, the RDN develops an individualized nutrition care plan, which may include dietary modifications, targeted supplementation, if indicated and within scope, and client education. Ongoing monitoring and evaluation are crucial to assess the effectiveness of the intervention and make necessary adjustments. This systematic process ensures that interventions are safe, effective, and ethically sound. Question 7. Investigation of a 55-year-old male patient with a recent diagnosis of hyperlipidemia reveals a diet high in processed foods, fried items, and red meat, with minimal intake of fruits, vegetables, and whole grains. He expresses confusion about good versus bad fats and is seeking guidance on how to improve his lipid profile through diet. He mentions seeing various conflicting articles online about fat consumption. Which of the following represents the most appropriate initial approach for the registered dietitian nutritionist, RDN, to address this patient's lipid metabolism concerns? Option A. Advise the patient to immediately eliminate all forms of dietary fat from his diet to rapidly lower his lipid levels. Option B. Educate the patient on the different types of dietary fats, saturated, unsaturated, trans, essential, and their impact on lipid metabolism, emphasizing the benefits of incorporating monounsaturated and polyunsaturated fats while moderating saturated and trans fat intake, and collaboratively develop a personalized, gradual dietary modification plan. Option C. Provide the patient with a generic, restrictive low-fat meal plan found on a popular health website, assuming it will be universally effective for hyperlipidemia. Option D. Recommend that the patient focus solely on reducing his intake of saturated fat, as this is the primary driver of high cholesterol, without addressing other dietary factors or fat types. The correct answer is B. Educate the patient on the different types of dietary fats, saturated, unsaturated, trans, essential, and their impact on lipid metabolism, emphasizing the benefits of incorporating monounsaturated and polyunsaturated fats while moderating saturated and trans fat intake, and collaboratively develop a personalized, gradual dietary modification plan. Explanation. This scenario presents a common clinical challenge where a patient's dietary intake directly impacts their metabolic health, specifically concerning lipid metabolism. The professional challenge lies in accurately assessing the patient's current dietary habits, understanding the complex interplay of different dietary fats on their lipid profile, and formulating evidence-based, individualized recommendations within the scope of practice for a registered dietitian nutritionist, RDN. The RDN must navigate the patient's personal preferences and potential misconceptions about dietary fats while adhering to established nutritional guidelines and scientific literature. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and education strategy. It acknowledges the multifactorial nature of lipid metabolism and the impact of various dietary components, not just saturated fats. By focusing on education and gradual, sustainable changes, it empowers the patient to make informed decisions and adopt healthier eating patterns. This aligns with the RDN's ethical responsibility to provide patient-centered care and promote health literacy. Furthermore, it adheres to the regulatory framework by operating within the scope of practice, which includes nutrition assessment, counseling, and education based on current scientific evidence. An incorrect approach that solely focuses on eliminating all dietary fat is professionally unacceptable. This fails to recognize that certain fats, like unsaturated fats and essential fatty acids, are crucial for health. Such a restrictive approach could lead to nutrient deficiencies and is not supported by current RDN practice guidelines or scientific consensus on lipid management. It also demonstrates a lack of understanding of the nuanced role of different fat types in metabolism. Another incorrect approach that relies on a single, unverified online source for dietary advice is ethically and professionally unsound. RDNs are bound by a code of ethics to provide evidence-based recommendations. Relying on unverified information undermines the credibility of the profession and could lead to harmful advice. This approach bypasses the critical thinking and evidence appraisal expected of an RDN. A third incorrect approach that prescribes a specific, rigid meal plan without considering the patient's lifestyle, preferences, or current intake is also problematic. While meal plans can be a tool, they must be tailored to the individual. A one-size-fits-all approach ignores the principles of personalized nutrition and can lead to poor adherence and patient dissatisfaction. It also fails to address the underlying knowledge gaps that may contribute to the patient's current dietary habits. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough nutrition assessment, including dietary intake, medical history, anthropometrics, and relevant lab values. 2. Educate the patient on the role of different types of dietary fats in lipid metabolism, emphasizing the benefits of unsaturated fats and the importance of limiting saturated and trans fats. 3. Collaborate with the patient to develop realistic, individualized dietary goals and strategies that incorporate their preferences and lifestyle. 4. Monitor progress and provide ongoing support and education, adjusting recommendations as needed. 5. Always base recommendations on current, evidence-based scientific literature and professional guidelines. Question 8. What factors determine the selection of appropriate dietary assessment methods and the integration of anthropometric, biochemical, and clinical data for a registered dietitian nutritionist, RDN, in developing a comprehensive nutrition care plan? Option A. The perceived ease of data collection for the RDN and the client's willingness to comply with any chosen method. Option B. The RDN's personal preference for specific assessment tools and the availability of standardized questionnaires. Option C. The time available for the assessment and the client's current body weight without considering other physiological markers. Option D. Client's ability to accurately recall and report intake, the purpose of the assessment, and the need for objective physiological data. The correct answer is D. Client's ability to accurately recall and report intake, the purpose of the assessment, and the need for objective physiological data. Explanation. Scenario analysis. This scenario presents a common challenge in dietetics, selecting the most appropriate dietary assessment method for a specific client. The challenge lies in balancing the need for comprehensive data with practical considerations such as client burden, time constraints, and the specific information required to address the client's health goals. A registered dietitian nutritionist, RDN, must exercise professional judgment to choose a method that yields reliable and valid data without overwhelming the client or compromising the quality of the assessment. The RDN's responsibility is to gather sufficient information to develop an individualized and effective nutrition care plan, adhering to professional standards of practice and ethical guidelines. Correct approach analysis. The correct approach involves a systematic evaluation of the client's needs, the purpose of the assessment, and the strengths and limitations of various dietary assessment tools. This aligns with the Academy of Nutrition and Dietetics standards of practice and professional performance, which emphasize the importance of selecting appropriate assessment methods based on the individual situation and the goals of nutrition care. For instance, a 24-hour recall might be suitable for a quick snapshot, while a food frequency questionnaire could be better for assessing long-term dietary patterns. A food record provides detailed intake but can be burdensome. A diet history offers a comprehensive overview of usual eating habits. Anthropometric measurements, biochemical data, and clinical findings provide objective data that, when combined with dietary intake, offer a holistic picture. The RDN must consider which combination of these tools will best inform the nutrition diagnosis and intervention. This approach ensures that the assessment is tailored, efficient, and ethically sound, prioritizing client well-being and evidence-based practice. Incorrect approach is analysis. Choosing a single, universally applied method without considering the client's unique circumstances represents a failure to adhere to individualized nutrition care principles. For example, relying solely on a 24-hour recall for a client with a complex medical history and multiple dietary restrictions might not capture the full scope of their nutritional status or habitual intake, leading to an incomplete or inaccurate nutrition diagnosis. Similarly, mandating a detailed food record for a client who struggles with literacy or has significant time constraints would be impractical and could lead to poor compliance and unreliable data, violating ethical considerations of client burden and respect. Using only anthropometric data without understanding dietary intake would miss crucial information for developing a nutrition intervention. Failing to consider the client's ability to accurately recall or record their intake, or their willingness to participate, also constitutes a regulatory and ethical lapse, as it compromises the validity of the data and the client's autonomy in the nutrition care process. Professional reasoning. Professionals should approach dietary assessment by first identifying the specific nutrition-related problem or goal. This involves understanding the client's medical history, lifestyle, cultural background, and personal preferences. Next, the RDN should consider the advantages and disadvantages of each assessment method in relation to the identified problem and the client's characteristics. For example, if the goal is to identify nutrient deficiencies, a more detailed method like a food record or diet history might be necessary. If the goal is to assess general eating patterns, a food frequency questionnaire might suffice. The RDN must also assess the client's ability and willingness to participate in each method. Open communication with the client about the purpose and process of the assessment is crucial. Finally, the RDN should integrate data from multiple sources, including dietary intake, anthropometric measurements, biochemical data, and clinical findings, to form a comprehensive nutrition assessment and develop an evidence-based, individualized nutrition care plan. Question 9. When evaluating the adequacy of iron intake for a group of female athletes in the United States, which approach best aligns with the regulatory framework and ethical guidelines for a registered dietitian nutritionist, RDN? Option A. Suggesting a broad spectrum of iron supplements without specific dosage guidance, based on anecdotal reports of improved energy levels among athletes. Option B. Relying on popular fitness blogs and social media influencers for the most up-to-date recommendations on iron intake for athletes. Option C. Recommending iron-rich foods based on a review of recent peer-reviewed studies and consulting the current dietary reference intakes, DRI, for the United States, while also considering factors like absorption enhancers and inhibitors. Option D. Prioritizing the inclusion of calcium-rich foods in the diet, as calcium is a widely recognized essential mineral, and assuming iron needs will be met incidentally. The correct answer is C. Recommending iron-rich foods based on a review of recent peer-reviewed studies and consulting the current dietary reference intakes, DRI, for the United States, while also considering factors like absorption enhancers and inhibitors. Explanation. This scenario presents a professional challenge because it requires the registered dietitian nutritionist, RDN, to navigate the complexities of mineral recommendations for a specific population group, ensuring adherence to established dietary guidelines and scientific evidence while considering individual needs. The RDN must critically evaluate information sources and apply knowledge of nutrient bioavailability and interactions. The correct approach represents best professional practice because it prioritizes evidence-based guidelines and considers the specific physiological needs of the population. By consulting authoritative sources such as the Dietary Reference Intakes, DRI, established by the Food and Nutrition Board of the Institute of Medicine, now the National Academies of Sciences, Engineering, and Medicine, the RDN ensures that recommendations are grounded in the most current scientific consensus for the United States. This aligns with the RDN's ethical responsibility to provide competent and evidence-based nutrition care, as mandated by the Commission on Dietetic Registration, CDR, Code of Ethics for the Profession of Dietetics. Adhering to these established guidelines ensures that recommendations are safe, effective, and appropriate for the target population, minimizing the risk of nutrient deficiencies or toxicities. An incorrect approach that relies solely on anecdotal evidence or popular health trends fails to meet professional standards. This would be a regulatory and ethical failure because it deviates from the requirement to practice based on scientific evidence and established guidelines. Such an approach could lead to suboptimal or even harmful nutrition advice, violating the RDN's duty of care. Another incorrect approach that focuses on a single mineral without considering its interactions with other nutrients or the overall dietary pattern is also professionally unacceptable. This demonstrates a lack of comprehensive understanding of micronutrient metabolism and can lead to imbalanced recommendations, potentially causing unintended consequences. This failure to consider the holistic impact of dietary intervention is a breach of professional competence. The professional decision-making process for similar situations involves a systematic approach. First, identify the specific nutritional needs of the client or population based on age, sex, physiological status, and health conditions. Second, consult authoritative, evidence-based resources, such as the DRIs, peer-reviewed scientific literature, and professional position papers. Third, critically evaluate the quality and relevance of all information sources, distinguishing between scientific consensus and unsubstantiated claims. Fourth, integrate individual client factors with established guidelines to develop personalized and safe nutrition recommendations. Finally, document the rationale for all recommendations and monitor the client's response, making adjustments as necessary. Question 10. System analysis indicates a registered dietitian nutritionist, RDN, is assessing a new client who reports a history of significant weight cycling over the past decade, experiencing periods of rapid weight loss followed by regain. The client's current weight is within a range that, based on body mass index, BMI alone, might be considered overweight. The RDN needs to determine the most appropriate anthropometric measurement to gain a comprehensive understanding of the client's body composition and nutritional status beyond a simple weight and height calculation. Which of the following approaches would best inform the RDN's nutritional assessment and intervention plan for this client? Option A. Rely primarily on body mass index, BMI, calculated from current height and weight. Option B. Utilize dual energy X-ray absorptiometry, DXA, to assess lean body mass, fat mass, and bone mineral density. Option C. Conduct multiple skin fold measurements at various sites to estimate body fat percentage. Option D. Focus exclusively on measuring waist circumference to assess central adiposity. Correct answer is B. Utilize dual energy X-ray absorptiometry, DXA, to assess lean body mass, fat mass, and bone mineral density. Explanation. This scenario presents a professional challenge due to the need to select the most appropriate anthropometric measurement for assessing nutritional status in a client with a history of significant weight fluctuations and potential for altered body composition. The registered dietitian nutritionist, RDN, must consider the limitations of each measurement in this specific context and adhere to professional standards of practice and ethical guidelines, which prioritize client well-being and accurate assessment. The correct approach represents best professional practice because it acknowledges the limitations of simpler measurements like BMI in individuals with atypical body compositions or histories of rapid weight changes. Body composition analysis, specifically methods like dual energy X-ray absorptiometry, DXA, provides a more nuanced understanding of fat mass and lean body mass distribution, which is crucial for accurate nutritional assessment and intervention planning. This aligns with the RDN's ethical obligation to provide competent and evidence-based care, ensuring that assessments are tailored to individual client needs and circumstances. Regulatory frameworks for RDNs emphasize the importance of using appropriate assessment tools to inform personalized nutrition care plans. An incorrect approach that relies solely on BMI would be professionally unacceptable because BMI does not differentiate between fat mass and lean body mass. In a client with a history of significant weight fluctuations, BMI could be misleading, potentially overestimating or underestimating adiposity, and thus leading to inappropriate nutritional recommendations. This failure to use the most accurate and appropriate assessment tool for the given client profile constitutes a deviation from best professional practice and could violate ethical standards related to providing competent care. Another incorrect approach, focusing exclusively on skin fold measurements without considering the client's history or potential for altered body composition, could also be problematic. While skin fold measurements can estimate body fat, their accuracy can be influenced by hydration status, the skill of the assessor, and the distribution of subcutaneous fat, which may be atypical in individuals with a history of significant weight changes. Relying solely on this method without corroboration or considering more comprehensive body composition analysis might not yield the most accurate picture of the client's nutritional status. A third incorrect approach, prioritizing waist circumference alone, would also be insufficient. While waist circumference is a valuable indicator of central adiposity and associated health risks, it does not provide a complete picture of overall body composition or nutritional status. It is a single data point that, when used in isolation, can overlook other critical aspects of body composition relevant to nutritional assessment. The professional decision-making process for similar situations should involve a thorough client history, consideration of the limitations of various anthropometric tools, and the selection of methods that provide the most comprehensive and accurate assessment of nutritional status for that individual. This includes understanding when simpler methods are adequate and when more sophisticated techniques are warranted to ensure evidence-based and client-centered care. Question 11. Risk assessment procedures indicate a patient's self-reported dietary intake during an initial interview appears inconsistent with their stated health goals and lifestyle. Which of the following approaches best represents a comprehensive and ethical nutrition assessment strategy in this situation? Option A. Rely on the initial interview data, assuming the patient is providing their best recollection, and proceed with developing a nutrition care plan based on that information. Option B. Request the patient to maintain a detailed food diary for 3 to 7 days and schedule a follow-up appointment to review it alongside the initial interview data. Option C. Gently inform the patient that their reported intake seems unlikely given their goals and suggest they adjust their diet based on general healthy eating guidelines. Option D. Ask the patient to list common foods they consume, and then use a standardized database to estimate their nutrient intake without further detailed inquiry. The correct answer is B. Request the patient to maintain a detailed food diary for 3 to 7 days and schedule a follow-up appointment to review it alongside the initial interview data. Explanation. This scenario presents a common challenge in nutrition assessment where a patient's self-reported dietary intake may not accurately reflect their true nutritional status due to various influencing factors. The professional challenge lies in discerning the most reliable and ethically sound method to gather accurate information while respecting patient autonomy and privacy, all within the scope of RDN practice as defined by U.S. regulations and the Academy of Nutrition and Dietetics, and standards of practice and professional performance. The correct approach represents best professional practice because it employs a multifaceted strategy that acknowledges the limitations of a single data point and prioritizes obtaining comprehensive, objective, and validated information. This aligns with the ethical principles, particularly those concerning competence, integrity, and professional responsibility, which mandate the use of evidence-based practices and the pursuit of accurate patient data for effective care planning. Utilizing multiple assessment methods, including a detailed dietary history, food diaries, and potentially biochemical data if indicated and available, allows for triangulation of information, leading to a more robust and reliable nutrition assessment. This approach respects the patient's experience while ensuring the RDN fulfills their duty to provide high-quality, evidence-based nutrition care. An incorrect approach that relies solely on a brief, unstructured interview without corroborating evidence fails to meet the standard of care. This is a regulatory and ethical failure because it risks generating an incomplete or inaccurate nutrition diagnosis, which can lead to ineffective or even harmful nutrition interventions. It demonstrates a lack of due diligence and may violate the RDN's responsibility to conduct a thorough assessment as outlined by professional standards. Another incorrect approach that involves making assumptions about the patient's diet based on their demographic information or a superficial understanding of common eating patterns is also professionally unacceptable. This constitutes a failure in ethical practice by introducing bias and stereotyping into the assessment process, undermining the principle of individualized care. Such an approach can lead to misdiagnosis and inappropriate recommendations, potentially harming the patient and violating the RDN's commitment to patient-centered care. Finally, an approach that involves sharing perceived inaccuracies of the patient's self-report with the patient in a judgmental manner is ethically unsound and professionally damaging. This violates the principle of respect for the patient and can erode trust, hindering the therapeutic relationship. It also demonstrates a lack of communication skills and empathy, which are crucial components of effective nutrition counseling and assessment. The professional decision-making process for similar situations should involve a systematic approach. First, gathering information through multiple validated methods. Second, critically analyzing the collected data for consistency and potential discrepancies. Third, engaging the patient in a collaborative discussion to explore any identified gaps or inconsistencies in a non-judgmental manner. And fourth, using the synthesized, comprehensive data to formulate an accurate nutrition diagnosis and individualized care plan. This iterative process ensures that the RDN acts with competence, integrity, and a commitment to the patient's well-being, adhering to U.S. regulatory frameworks and professional ethical guidelines. Question 12. Strategic planning requires a registered dietitian nutritionist, RDN, to assess a client's request to start a new dietary supplement aimed at boosting energy levels. The client has heard that certain trace minerals are crucial for energy metabolism. The RDN's primary responsibility is to ensure the client's safety and well-being while providing evidence-based nutrition guidance. Which of the following approaches best aligns with the RDN's professional and ethical obligations? Option A. Immediately recommend a broad-spectrum trace mineral supplement to ensure the client is adequately covered, as trace minerals are generally beneficial for energy. Option B. Suggest the client purchase a specific popular trace mineral supplement the RDN has seen advertised, as it is likely to be effective for energy. Option C. Conduct a thorough dietary assessment to understand the client's current trace mineral intake and overall nutritional status. Explore the client's specific reasons for wanting the supplement, and then provide evidence-based recommendations regarding the supplement's potential benefits, risks, and alternatives, considering the client's individual health profile. Option D. Advise the client that trace minerals are complex and that they should consult a physician before considering any supplements, without further RDN involvement. The correct answer is C. Conduct a thorough dietary assessment to understand the client's current trace mineral intake and overall nutritional status. Explore the client's specific reasons for wanting the supplement, and then provide evidence-based recommendations regarding the supplement's potential benefits, risks, and alternatives, considering the client's individual health profile. Explanation. Scenario analysis. This scenario presents a common challenge for registered dietitian nutritionists, RDN, where a client expresses interest in a specific dietary supplement without adequate understanding of its potential risks and benefits, particularly concerning trace minerals. The RDN must navigate the client's personal beliefs and desires with evidence-based practice and regulatory guidelines for providing nutrition advice. The challenge lies in balancing client autonomy with the RDN's professional responsibility to ensure safe and effective nutrition interventions, especially when dealing with substances that can have both therapeutic and toxic effects if misused. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the client's current dietary intake, health status, and the rationale behind their interest in the supplement. This aligns with the Academy of Nutrition and Dietetics Code of Ethics, which emphasizes providing evidence-based, individualized nutrition care. Specifically, it adheres to the principle of competence and integrity in professional practice, requiring RDNs to practice within their scope and to base recommendations on scientific evidence. By thoroughly evaluating the client's needs and the supplement's potential impact on their trace mineral status, e.g., iron, zinc, iodine, selenium, copper, fluoride, the RDN can provide personalized, safe, and effective guidance. This approach respects the client's autonomy while upholding the RDN's ethical and professional obligations to prevent harm and promote well-being, as mandated by the RDN credentialing body standards. Incorrect approach is analysis. Recommending the supplement without further assessment fails to uphold the RDN's ethical duty of competence and integrity in professional practice. It bypasses the crucial step of individualized assessment, potentially leading to adverse effects from trace mineral toxicity or masking underlying deficiencies that require different interventions. This approach is a direct violation of the principle to provide evidence-based nutrition services. Dismissing the client's interest without exploration is unprofessional and undermines the therapeutic relationship. While not directly violating a specific regulation, it fails to meet the ethical standard of respecting the dignity and rights of clients. An RDN should explore the client's motivations and concerns before dismissing them, even if the initial request is not evidence-based. Suggesting a generic, one-size-fits-all supplement regimen for trace minerals ignores the individualized nature of nutrition and the potential for toxicity or imbalance. This approach violates the principle of competence and integrity in professional practice by not tailoring recommendations to the client's specific needs and health status, and it disregards the potential for harm from excessive intake of certain trace minerals. Professional reasoning. When faced with a client's interest in a specific supplement, an RDN should employ a systematic, client-centered approach. This involves 1. Active listening and exploration. Understand the client's motivations, beliefs, and perceived benefits of the supplement. 2. Comprehensive assessment. Evaluate the client's current dietary intake, medical history, current medications, and any existing nutrient deficiencies or excesses, particularly concerning trace minerals. 3. Evidence-based evaluation. Research the scientific literature regarding the specific supplement, its purported benefits, potential risks, and its impact on trace mineral status. 4. Individualized recommendation. Based on the assessment and evidence, provide personalized recommendations that may include dietary modifications, lifestyle changes, or, if scientifically supported and deemed safe, the judicious use of supplements. 5. Client education. Clearly explain the rationale behind recommendations, including potential benefits, risks, and alternatives, empowering the client to make informed decisions. 6. Documentation. Maintain thorough records of the assessment, recommendations, and client discussion. Question 13. Governance review demonstrates that a 68-year-old female patient presents with generalized fatigue, intermittent muscle cramps, and a history of hypertension managed with a diuretic. During the physical examination, the RDN notes mild edema in the lower extremities and dry, flaky skin. The patient reports a recent unintentional weight loss of 5 pounds over 2 months. Which of the following approaches best guides the RDN's initial assessment of potential clinical findings related to nutrient status? Option A. Immediately focus on assessing for a potential iron deficiency anemia given the reported fatigue and unintentional weight loss, as these are common presenting symptoms. Option B. Emphasize the dry, flaky skin as a primary indicator of a vitamin A deficiency, and suggest increasing intake of vitamin A-rich foods. Option C. Prioritize a comprehensive review of the patient's current medication regimen, correlating potential side effects or interactions with the reported fatigue, muscle cramps, edema, and skin changes, while simultaneously considering the impact of unintentional weight loss on overall nutrient stores. Option D. Conclude that the edema and muscle cramps are likely due to a potassium imbalance, a known side effect of her diuretic, and recommend a potassium supplement. The correct answer is C. Prioritize a comprehensive review of the patient's current medication regimen, correlating potential side effects or interactions with the reported fatigue, muscle cramps, edema, and skin changes, while simultaneously considering the impact of unintentional weight loss on overall nutrient stores. Explanation. This scenario is professionally challenging due to the subtle and potentially overlapping nature of the clinical findings. Differentiating between signs and symptoms that point to a specific nutrient deficiency, an excess, or are simply unrelated to nutritional status requires a systematic and evidence-based approach. The registered dietitian nutritionist, RDN, must integrate information from multiple sources, including the patient's medical history, physical examination, and current medications, to form a comprehensive assessment. This requires careful judgment to avoid misdiagnosis and ensure appropriate, individualized nutrition interventions. The correct approach represents best professional practice because it prioritizes a thorough and systematic evaluation of all available data before formulating a diagnosis or intervention plan. This aligns with the Academy of Nutrition and Dietetics standards of practice and professional performance, which emphasize the importance of a comprehensive nutrition assessment. Specifically, it adheres to the principle of gathering subjective and objective data, analyzing it within the context of the patient's medical history and medications, and then identifying potential nutrition problems. This methodical process ensures that interventions are targeted and effective, minimizing the risk of harm from inappropriate recommendations. It also reflects the ethical obligation to provide competent and evidence-based care. An incorrect approach that focuses solely on a single symptom without considering the broader clinical picture is professionally unacceptable. This could lead to a misattribution of the symptom to a nutritional cause when it may be related to an underlying medical condition or medication side effect, violating the ethical principle of non-maleficence. Another incorrect approach that jumps to a specific nutrient deficiency diagnosis based on limited information fails to conduct a complete assessment, potentially overlooking other critical factors and leading to an ineffective or even harmful intervention. This breaches the professional standard of care, which mandates a comprehensive evaluation. Furthermore, an approach that disregards the patient's medication list when interpreting physical findings or symptoms is a significant regulatory and ethical failure. Medications can directly cause or mask nutrient deficiencies or excesses, and failing to consider this interaction is a critical oversight in patient care. Professionals should employ a decision-making framework that begins with a comprehensive data-gathering phase, encompassing subjective information, patient's report of symptoms, medical history and objective information, physical examination findings, laboratory data, medication review. This data is then analyzed to identify potential nutrition-related problems, considering differential diagnoses. The RDN should then prioritize these problems and develop an individualized nutrition intervention plan based on evidence and the patient's unique needs and preferences. Regular reassessment and evaluation of the intervention's effectiveness are crucial components of this process. Question 14. Stakeholder feedback indicates that some patients are expressing frustration with the perceived rigidity of dietary recommendations, suggesting a desire for more personalized approaches that acknowledge their lifestyle and preferences more readily. A new patient presents with a history of type 2 diabetes and hypertension, currently managed with medication. During the initial interview, the patient expresses a strong preference for a specific popular fad diet, citing anecdotal success stories they have heard. The RDN has reviewed the patient's recent laboratory values, which show borderline elevated LDL cholesterol and a slightly elevated HbA1c. Which of the following approaches best aligns with the RDN's professional responsibilities and the nutrition care process? Option A. Focus solely on the patient's stated preference for the fad diet and provide general guidance on how to incorporate it, without conducting a full assessment or addressing the specific laboratory values. Option B. Advise the patient that their preferred fad diet is not evidence-based and refuse to provide any further nutrition counseling until they agree to follow a standard diabetic diet plan. Option C. Conduct a comprehensive nutrition assessment, including detailed dietary intake, anthropometrics, medical history, and psychosocial factors. Based on this assessment, develop a nutrition diagnosis and an evidence-based intervention plan that incorporates the patient's preferences where appropriate and safe, while educating them on the potential risks and benefits of their preferred fad diet in relation to their health conditions. Option D. Immediately implement the fad diet the patient has requested, as patient preference is the primary driver of adherence and satisfaction, and document this decision. The correct answer is C. Conduct a comprehensive nutrition assessment, including detailed dietary intake, anthropometrics, medical history, and psychosocial factors. Based on this assessment, develop a nutrition diagnosis and an evidence-based intervention plan that incorporates the patient's preferences where appropriate and safe, while educating them on the potential risks and benefits of their preferred fad diet in relation to their health conditions. Explanation. This scenario presents a professional challenge because it requires the registered dietitian nutritionist, RDN, to navigate conflicting information and stakeholder priorities while adhering to the core principles of the nutrition care process and professional ethical standards. The RDN must balance the patient's expressed preferences with evidence-based practice and the need for comprehensive data collection to ensure safe and effective nutritional intervention. Careful judgment is required to avoid bias, ensure patient autonomy, and maintain professional accountability. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based approach to nutrition assessment and intervention, aligning with the Academy of Nutrition and Dietetics Standards of Practice and Professional Performance, SOP, for RDNs. This approach involves gathering objective data, conducting a thorough assessment, developing a diagnosis based on that assessment, planning an appropriate intervention, and establishing a plan for monitoring and evaluation. This ensures that the intervention is tailored to the individual's needs, safe and effective, and that progress can be objectively measured. Documentation of each step is crucial for continuity of care, legal protection, and professional accountability, as mandated by ethical guidelines and potentially state licensure laws. An incorrect approach that relies solely on the patient's stated preference without a comprehensive assessment is professionally unacceptable. This fails to meet the RDN's ethical obligation to provide evidence-based care and could lead to an unsafe or ineffective intervention. It bypasses critical steps of the nutrition care process, such as identifying potential nutrient deficiencies or excesses, or contraindications to certain dietary patterns, thereby violating the RDN's duty of care. Another incorrect approach that involves implementing an intervention based on anecdotal evidence or trends without a thorough assessment is also professionally unacceptable. This disregards the scientific foundation of nutrition and the need for individualized care. It can lead to harm if the anecdotal recommendation is not appropriate for the patient's specific medical condition, lifestyle, or nutritional status. This approach demonstrates a lack of critical thinking and adherence to evidence-based practice, which are core competencies for RDNs. A third incorrect approach that focuses on a single data point without considering the broader clinical picture is professionally unacceptable. Nutrition assessment is a holistic process, focusing on one aspect, such as a single lab value or a patient's perceived symptom, without integrating it with other relevant data, medical history, anthropometrics, dietary intake, social determinants of health, can lead to misdiagnosis and inappropriate interventions. This demonstrates a failure to conduct a comprehensive assessment, a fundamental requirement for ethical and effective nutrition practice. A professional decision-making process for similar situations should involve a structured approach. First, acknowledge and validate stakeholder feedback. Second, initiate a comprehensive nutrition assessment, gathering all necessary subjective and objective data. Third, analyze the collected data to formulate a nutrition diagnosis. Fourth, develop an evidence-based intervention plan that addresses the diagnosis and considers patient preferences and goals. Fifth, establish clear monitoring and evaluation parameters. Finally, meticulously document all findings, decisions, and plans in accordance with professional standards and regulatory requirements. This systematic process ensures that care is patient-centered, evidence-based, and ethically sound. Question 15. Process analysis reveals a hospitalized patient with a history of heart failure and renal insufficiency is exhibiting mild confusion and dry mucous membranes. Laboratory results show a serum sodium of 135 mg/L and a serum potassium of 4.0 mg/L. The patient's intake has been limited due to nausea, and urine output has been adequate but concentrated. Which of the following approaches best reflects best practice for the registered dietitian, nutritionist in managing this patient's fluid and electrolyte balance? Option A. Advise the patient to restrict fluid intake to prevent further dilution of electrolytes. Option B. Administer intravenous fluids as prescribed by the physician to correct the serum sodium level. Option C. Focus solely on increasing protein intake to improve overall hydration status. Option D. Recommend a moderate increase in fluid intake, prioritizing oral fluids with electrolytes, and monitor for improvement in mental status and mucous membrane hydration. The correct answer is D. Recommend a moderate increase in fluid intake, prioritizing oral fluids with electrolytes, and monitor for improvement in mental status and mucous membrane hydration. Explanation. This scenario presents a common challenge in clinical nutrition practice, managing a patient with complex fluid and electrolyte needs, where the initial assessment may not fully capture the dynamic nature of their condition. The professional challenge lies in interpreting subtle clinical signs and laboratory values to determine the most appropriate intervention, balancing the risks of both dehydration and overhydration, while adhering to established RDN practice standards and ethical guidelines. Careful judgment is required to avoid over-reliance on a single data point and to consider the patient's overall clinical picture. Correct approach represents best professional practice because it involves a comprehensive and individualized assessment of the patient's fluid and electrolyte status. This includes not only reviewing laboratory data, but also considering clinical signs and symptoms, intake and output records, and the patient's underlying medical conditions. This holistic approach aligns with the RDN scope of practice, which mandates evidence-based practice and patient-centered care. Adherence to the Academy of Nutrition and Dietetics standards of practice and professional performance ensures that the RDN is acting within ethical and professional boundaries, prioritizing patient safety and well-being. An incorrect approach that relies solely on a single laboratory value, such as serum sodium, without considering other clinical indicators, fails to meet the standard of comprehensive assessment. This could lead to inappropriate fluid or electrolyte interventions, potentially exacerbating the patient's condition and violating the ethical principle of beneficence, acting in the patient's best interest. Another incorrect approach might be to implement a standardized fluid protocol without reassessing the patient's response, which disregards the individualized nature of nutrition care and could lead to overhydration or dehydration, failing to meet the standard of individualized nutrition care. A third incorrect approach, such as delaying intervention due to uncertainty without seeking further consultation or clarification, could be considered a failure to act in a timely manner to prevent harm, potentially violating ethical obligations to the patient. Professional decision-making in such situations should involve a systematic process. 1. Gather all relevant data, clinical, laboratory, dietary. 2. Analyze the data in the context of the patient's medical history and current condition. 3. Formulate a differential diagnosis for the fluid and electrolyte imbalance. 4. Develop an individualized plan of care, considering potential risks and benefits of interventions. 5. Monitor the patient's response to interventions and adjust the plan as needed. 6. Document all assessments, interventions, and outcomes. If uncertainty persists, consult with the interdisciplinary healthcare team. Question 16. Cost-benefit analysis shows that optimizing protein metabolism for improved health outcomes requires a nuanced understanding of various dietary strategies. Considering the metabolic pathways of amino acids, protein synthesis, and nitrogen balance, which of the following approaches best aligns with evidence-based nutrition practice for an adult seeking to enhance muscle protein synthesis and overall well-being? Option A. Prioritizing a diet rich in a variety of complete protein sources, ensuring adequate intake of essential amino acids, and considering the timing of protein consumption relative to physical activity. Option B. Suggesting the consumption of a single, highly bioavailable protein source as the primary dietary strategy, while minimizing intake of other protein-containing foods. Option C. Recommending high-dose supplementation of branched-chain amino acids, BCAA, to directly stimulate muscle protein synthesis, irrespective of overall dietary protein intake. Option D. Focusing exclusively on increasing total daily protein intake to the highest feasible level, assuming that more protein will always lead to greater metabolic benefits. The correct answer is A. Prioritizing a diet rich in a variety of complete protein sources, ensuring adequate intake of essential amino acids, and considering the timing of protein consumption relative to physical activity. Explanation. This scenario is professionally challenging because it requires the registered dietitian nutritionist, RDN, to navigate the complex interplay of protein metabolism, individual nutritional needs, and the ethical imperative to provide evidence-based, patient-centered care within the scope of practice. The RDN must consider not only the scientific principles of protein digestion, absorption, transport, and metabolism, including amino acid pathways and protein quality, but also how these factors translate into practical dietary recommendations across different life stages and health statuses. The challenge lies in tailoring these recommendations to optimize health outcomes while adhering to professional standards and avoiding unsubstantiated claims or interventions. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that integrates scientific knowledge of protein metabolism with the patient's unique physiological state, dietary history, and health goals. This aligns with the RDN's ethical responsibility to provide competent and evidence-based nutrition care, as outlined by the Commission on Dietetic Registration, CDR, Code of Ethics for the Profession of Dietetics. Specifically, it upholds principles of beneficence acting in the patient's best interest, non-maleficence, avoiding harm, and autonomy, respecting the patient's right to make informed decisions. By focusing on established metabolic pathways and protein quality metrics, the RDN ensures recommendations are grounded in scientific validity and are appropriate for the individual's lifespan needs. An incorrect approach that focuses solely on increasing protein intake without considering the specific metabolic context or individual requirements would be professionally unacceptable. This could lead to potential harm, such as exacerbating existing kidney issues in susceptible individuals or creating an imbalanced diet, violating the principle of non-maleficence. Furthermore, recommending specific amino acid supplements without a clear diagnosis of deficiency or a specific metabolic disorder, and without considering the body's natural synthesis capabilities and the urea cycle's role in nitrogen excretion, could be considered practicing outside the scope of standard nutritional counseling and potentially lead to adverse effects, violating the principle of competence and potentially the principle of non-maleficence. Another incorrect approach might involve promoting a single superfood for protein, ignoring the concept of protein quality and the need for a balanced intake of essential and non-essential amino acids, which fails to provide a scientifically sound and comprehensive nutritional strategy. Professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's current health status, medical history, and nutritional intake, paying close attention to any conditions affecting protein metabolism. Second, apply current scientific knowledge regarding protein digestion, absorption, amino acid metabolism, and protein synthesis to understand the physiological underpinnings of the patient's needs. Third, evaluate protein quality and requirements based on established guidelines and the patient's life stage and activity level. Fourth, develop a personalized nutrition plan that is evidence-based, safe, effective, and respects patient preferences and cultural factors. Finally, monitor the patient's response to the nutrition intervention, and make adjustments as necessary, always operating within the RDN scope of practice and ethical guidelines. Question 17. The evaluation methodology shows that an older adult client reports experiencing fatigue and occasional mild cognitive fogginess. They consume a diet that is primarily plant-based but includes limited dairy and no meat or fish. They are also taking a daily multivitamin that contains moderate doses of most B vitamins and vitamin C. Considering the functions, sources, and deficiency/toxicity profiles of water-soluble vitamins, what is the most appropriate initial step for the RDN to take in assessing this client's nutritional status regarding these vitamins? Option A. Advise the client to discontinue their current multivitamin to avoid potential toxicity and focus solely on a varied diet. Option B. Immediately recommend increasing the intake of vitamin C-rich foods and a B-complex supplement, assuming the client's symptoms are indicative of a deficiency. Option C. Focus on assessing iron and vitamin D intake, as these are more common deficiencies in older adults, and consider water-soluble vitamins as a secondary concern. Option D. Conduct a detailed 24-hour dietary recall and a 3-day food record to assess specific intake of B vitamins and vitamin C. Inquire about the rationale for multivitamin use, and review the multivitamin's ingredient list for potential excessive amounts of any water-soluble vitamin. The correct answer is D. Conduct a detailed 24-hour dietary recall and a 3-day food record to assess specific intake of B vitamins and vitamin C. Inquire about the rationale for multivitamin use, and review the multivitamin's ingredient list for potential excessive amounts of any water-soluble vitamin. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered dietitian nutritionist RDN to assess a client's risk for deficiency of multiple water-soluble vitamins, considering their unique life stage and dietary habits. The challenge lies in synthesizing information about various vitamins, their functions, sources, and the specific needs of an older adult, while also acknowledging the potential for toxicity with certain supplements. A careful, evidence-based approach is crucial to avoid misdiagnosis or inappropriate recommendations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. It involves gathering detailed dietary history, reviewing current supplement use, and considering age-related physiological changes that can impact nutrient absorption and requirements. This aligns with the RDN's ethical responsibility to provide patient-centered care and adhere to evidence-based guidelines for nutrient intake across the lifespan, as outlined by professional standards and regulatory bodies governing RDN practice in the U.S. The focus on identifying specific dietary gaps and potential interactions before recommending interventions is paramount. Incorrect approaches analysis. One incorrect approach fails to consider the specific nutrient needs of older adults, potentially leading to recommendations that are either insufficient or excessive. This overlooks the physiological changes associated with aging, such as decreased nutrient absorption and increased risk of certain deficiencies, which are critical considerations for water-soluble vitamins. This approach may violate ethical principles of providing competent care tailored to individual needs. Another incorrect approach focuses solely on supplementation without a thorough dietary assessment. This is a regulatory and ethical failure, as it bypasses the fundamental RDN responsibility to explore dietary sources first, and can lead to unnecessary expense, potential toxicity, and masking of underlying dietary issues. It also fails to address the root cause of any potential deficiency. A third incorrect approach might overemphasize the risk of toxicity for all water-soluble vitamins, leading to overly restrictive recommendations that could inadvertently cause deficiencies. While toxicity is a concern for some nutrients, particularly with megadosing, a balanced approach is necessary, and a blanket avoidance of certain vitamins based on a generalized fear of toxicity is not evidence-based or professionally sound. This could be considered a failure in providing accurate and comprehensive nutritional guidance. Professional reasoning. When faced with a client presenting with potential nutrient concerns, the RDN should employ a systematic decision-making process. This begins with a thorough client assessment, including medical history, lifestyle, and detailed dietary intake. Next, The RDN should consult current evidence-based guidelines and scientific literature relevant to the client's age and health status. Based on this information, the RDN identifies potential nutrient gaps or excesses and develops an individualized nutrition care plan. This plan should prioritize dietary modifications and, if necessary, judicious supplementation, always considering potential risks and benefits. Regular follow-up and reassessment are essential to monitor progress and adjust the plan as needed. This structured approach ensures that recommendations are safe, effective, and ethically sound, adhering to the standards of practice for RDNs. Question 18. The risk matrix shows a moderate risk of psychological distress and potential relapse into disordered eating behaviors when implementing a weight gain plan for a patient with a history of anorexia nervosa who now requires significant caloric increase due to a new medical condition. As a registered dietitian nutritionist, RDN, which of the following strategies best addresses this complex situation while adhering to professional standards and ethical guidelines? Option A. Immediately initiate a high-calorie, nutrient-dense meal plan with strict adherence requirements to rapidly achieve the necessary weight gain, emphasizing the critical medical necessity of the intervention. Option B. Recommend the patient consult with a bariatric surgeon to explore surgical options for weight management, as this is often a more controlled and predictable method for achieving significant weight gain. Option C. Prescribe appetite stimulant medication to facilitate increased food intake, as this is a direct pharmacological approach to address the caloric deficit. Option D. Implement a gradual, patient-centered weight gain plan that incorporates motivational interviewing techniques to explore the patient's readiness for change, addresses their food preferences and fears, and includes regular check-ins with a mental health professional. The correct answer is D. Implement a gradual, patient-centered weight gain plan that incorporates motivational interviewing techniques to explore the patient's readiness for change, addresses their food preferences and fears, and includes regular check-ins with a mental health professional. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing a patient with a history of disordered eating alongside a new diagnosis requiring significant weight gain. The registered dietitian nutritionist, RDN, must navigate the delicate balance between promoting necessary nutritional intake for health and avoiding triggers that could exacerbate the patient's past psychological struggles. This requires a nuanced approach that prioritizes patient safety, autonomy, and evidence-based practice within the scope of RDN practice, as defined by the Commission on Dietetic Registration, CDR, and relevant state licensure laws. The correct approach emphasizes a collaborative, patient-centered strategy that integrates behavioral modification techniques with nutritional guidance. This aligns with ethical principles of beneficence and non-maleficence, ensuring the patient's well-being is paramount. By focusing on gradual, sustainable changes, incorporating the patient's preferences, and utilizing motivational interviewing, the RDN respects the patient's agency and builds trust. This approach is supported by evidence-based guidelines for weight management and disordered eating recovery, which advocate for a multidisciplinary team and a phased approach to nutritional rehabilitation. The RDN's role is to provide expert nutrition advice and support, empowering the patient to make informed decisions. An incorrect approach would be to solely focus on aggressive caloric increases without addressing the psychological component. This could lead to increased anxiety, guilt, and potential relapse into disordered eating patterns, violating the ethical principle of non-maleficence. Another incorrect approach would be to prescribe a rigid, prescriptive meal plan without patient input or consideration of their history. This disregards the patient's autonomy and can foster a sense of control loss, which is detrimental for individuals with a history of disordered eating. Furthermore, recommending pharmacological or surgical interventions without a thorough assessment by a physician and a multidisciplinary team would exceed the RDN scope of practice and could pose significant health risks, violating professional boundaries and potentially leading to regulatory action. The professional decision-making process for similar situations involves a comprehensive assessment of the patient's medical history, psychological state, social support, and personal preferences. It requires a thorough understanding of the interplay between nutrition, behavior, and mental health. The RDN should engage in active listening, empathy, and motivational interviewing to build rapport and identify the patient's readiness for change. Collaboration with other healthcare professionals, such as physicians, therapists, and psychiatrists, is crucial to ensure a holistic and safe treatment plan. The RDN must continuously monitor the patient's progress, adjust interventions as needed, and prioritize the patient's psychological safety alongside their physical health goals. Question 19. Operational review demonstrates that a registered dietitian nutritionist, RDN, is developing a nutrition care plan for a patient newly diagnosed with type 2 diabetes. The patient has a moderate understanding of basic nutrition, but struggles with the concept of how different foods impact their blood sugar levels and the role of hormones like insulin and glucagon. The RDN needs to translate the complex physiological processes of carbohydrate digestion, absorption, transport, and the body's regulatory mechanisms into practical dietary advice. Which of the following approaches best aligns with the RDN's scope of practice and ethical responsibilities in this scenario? Option A. Provide the patient with a strict, predetermined meal plan that limits all forms of sugar and refined carbohydrates to less than 20 grams per day, without a detailed explanation of the underlying metabolic reasons. Option B. Focus on educating the patient about the glycemic index and glycemic load of various carbohydrate-containing foods, emphasizing whole grains, fruits, and vegetables, and explaining how the fiber content in these foods slows glucose absorption, thereby supporting more stable blood glucose levels and a balanced insulin response. Option C. Recommend a general guideline of consuming 45-60 grams of carbohydrates per meal, without discussing the quality of the carbohydrates or the patient's individual metabolic response. Option D. Advise the patient to avoid all carbohydrates and focus solely on protein and fat intake to manage blood glucose, citing that this is the most effective way to prevent blood sugar spikes. The correct answer is B. Focus on educating the patient about the glycemic index and glycemic load of various carbohydrate-containing foods, emphasizing whole grains, fruits, and vegetables, and explaining how the fiber content in these foods slows glucose absorption, thereby supporting more stable blood glucose levels and a balanced insulin response. Explanation. Scenario analysis. This scenario presents a common challenge in clinical nutrition practice where a registered dietitian nutritionist, RDN, must interpret and apply complex metabolic information to a patient's dietary plan. The challenge lies in translating the physiological understanding of carbohydrate metabolism, particularly the interplay of insulin and glucagon in blood glucose regulation, into practical, actionable dietary recommendations for a patient with type 2 diabetes. The RDN must consider not only the biochemical pathways, but also the patient's individual needs, lifestyle, and the potential impact of different carbohydrate sources and forms on glycemic control. This requires a deep understanding of carbohydrate digestion, absorption, and transport, as well as the hormonal mechanisms that maintain glucose homeostasis. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current dietary intake, understanding their individual glycemic response to various carbohydrates, and then developing a personalized meal plan that strategically incorporates complex carbohydrates, fiber, and appropriate protein and fat sources. This approach aligns with the RDN scope of practice, emphasizing evidence-based nutrition care and patient-centered education. It directly addresses the core principles of carbohydrate metabolism by considering how different food choices affect blood glucose levels and how insulin and glucagon will respond. The focus on dietary fiber and its impact on slowing glucose absorption and improving satiety is a key component of managing type 2 diabetes, directly relating to the topic of carbohydrate metabolism and its health implications. This approach prioritizes patient safety and optimal health outcomes by tailoring recommendations to the individual's metabolic profile and disease state. Incorrect approaches analysis. One incorrect approach would be to solely focus on carbohydrate counting without considering the quality and type of carbohydrates consumed. This fails to acknowledge the nuanced impact of different carbohydrate sources, e.g., refined sugars vs. whole grains, on glycemic response and hormonal regulation. It overlooks the importance of fiber and other macronutrients in modulating glucose absorption and insulin sensitivity, which is a critical aspect of managing blood glucose. This approach is ethically problematic as it may lead to suboptimal patient outcomes by not providing a holistic and individualized nutrition intervention. Another incorrect approach would be to recommend a very low-carbohydrate diet without a thorough assessment of the patient's metabolic status, potential contraindications, or the patient's ability to adhere to such a restrictive plan. While low-carbohydrate diets can be effective for some individuals with type 2 diabetes, their implementation requires careful consideration of individual responses and potential risks, such as nutrient deficiencies or adverse effects on lipid profiles. This approach could be considered negligent if not properly assessed and monitored, potentially failing to meet the patient's nutritional needs and leading to unintended health consequences. A third incorrect approach would be to provide generic dietary advice based on broad recommendations for carbohydrate intake, without considering the patient's specific metabolic profile, medication regimen, or lifestyle. This fails to meet the RDN's professional responsibility to provide individualized nutrition care. It neglects the critical role of insulin and glucagon in regulating blood glucose and how different dietary patterns can influence these hormonal responses. Such an approach is ethically deficient as it does not uphold the standard of care expected of an RDN. Professional reasoning. Professionals should approach this situation by first conducting a thorough nutritional assessment, including a detailed dietary history, anthropometric measurements, and relevant biochemical data. This assessment should inform the development of a personalized nutrition intervention plan that considers the patient's glycemic control, comorbidities, preferences, and cultural background. The RDN should then educate the patient on the principles of carbohydrate metabolism, the role of different carbohydrate types in fiber, and how to make informed food choices to manage their blood glucose effectively. Ongoing monitoring and evaluation of the patient's response to the nutrition intervention are crucial for making necessary adjustments and ensuring optimal outcomes. Question 20. The audit findings indicate that a registered dietitian nutritionist, RDN, is reviewing a patient's progress in a weight management program. The patient reports feeling satisfied with their current food intake and expresses a desire to maintain their current calorie consumption, stating they don't feel hungry. However, objective data from the patient's recent metabolic testing suggests a lower resting energy expenditure than previously calculated, and their reported physical activity levels have decreased. The RDN must determine the most appropriate next step in the patient's nutrition care plan. Option A. Recommend a reduction in the patient's daily calorie intake, explaining how the new metabolic data and decreased activity level necessitate this adjustment to support their weight management goals, while still addressing their satiety cues. Option B. Focus solely on increasing the patient's physical activity to compensate for the lower metabolic rate, without altering their current calorie intake. Option C. Continue with the current calorie prescription, as the patient reports feeling satisfied and not hungry, prioritizing their subjective experience over objective physiological data. Option D. Advise the patient to increase their calorie intake to ensure they are meeting their perceived energy needs, despite the new metabolic data. The correct answer is A. Recommend a reduction in the patient's daily calorie intake, explaining how the new metabolic data and decreased activity level necessitate this adjustment to support their weight management goals, while still addressing their satiety cues. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered dietitian nutritionist, RDN, to navigate a situation where a patient's stated preferences and perceived needs for energy intake may not align with established physiological requirements for weight management and overall health, as dictated by evidence-based practice and regulatory guidelines for RDNs. The RDN must balance patient autonomy with their professional responsibility to provide safe and effective nutrition care, adhering to the scope of practice and ethical principles. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that integrates objective data, e.g., metabolic rate, activity level, medical history, with subjective patient information. This aligns with the Academy of Nutrition and Dietetics standards of practice and professional performance, which mandate evidence-based practice and patient-centered care. Specifically, it upholds the ethical principle of beneficence by ensuring the patient receives nutrition recommendations that are physiologically sound and promote their well-being, while also respecting their autonomy by engaging them in the decision-making process. This approach ensures that the RDN is acting within their scope of practice by utilizing their expertise to interpret data and formulate recommendations, rather than simply accepting a patient's self-reported intake without critical evaluation. Incorrect approach is analysis. One incorrect approach fails to consider the patient's metabolic rate and activity level, relying solely on the patient's subjective report of feeling full and their desire for a specific calorie intake. This is a regulatory and ethical failure because it neglects the RDN's responsibility to conduct a thorough nutritional assessment, which is a cornerstone of safe and effective practice. It bypasses the scientific basis of energy balance and can lead to inappropriate recommendations that do not support the patient's health goals, potentially violating the principle of non-maleficence by recommending a suboptimal or harmful intake. Another incorrect approach prioritizes the patient's stated desire for a high-calorie intake without critically evaluating its appropriateness in the context of their weight management goals and overall health status. This represents a failure to adhere to evidence-based practice and can be seen as a dereliction of professional duty. The RDN is ethically bound to provide guidance that is scientifically supported and promotes health, not to simply acquiesce to patient demands that may be detrimental. This approach risks undermining the patient's health outcomes and the RDN's credibility. A third incorrect approach focuses exclusively on the patient's perceived hunger cues without considering the broader physiological and metabolic factors influencing energy balance. While hunger is an important cue, it is not the sole determinant of appropriate energy intake, especially in a weight management context. This approach is a failure to apply comprehensive nutritional science and can lead to inaccurate energy recommendations, potentially hindering the patient's progress and violating the principle of beneficence. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment, gathering all relevant objective and subjective data. This is followed by diagnosis, where the RDN identifies nutrition-related problems. The next step is intervention, where evidence-based strategies are developed in collaboration with the patient. Finally, monitoring and evaluation are crucial to assess the effectiveness of the intervention and make necessary adjustments. This iterative process ensures that patient care is dynamic, responsive, and grounded in professional expertise and ethical principles.